There's the whole issue of normative aging and how to optimize that process to enter your mid 80s and later as vigorously healthy and independent living as possible. I mean, if you think about this baby boom generation coming up, if only there was a 20% improvement in independency, so that 20% more people who would otherwise have become dependent, let's say by age 85, do not, the saving to the healthcare system will be phenomenal. And I guess the big point is that not everything is going to be fixed by a pill. And even normative exercise may not be the right thing for everybody. So the Van Arden did work with people over the years, and in his clinic he had a big research institute in Germany, and like everything else was fraught with politics, because I think he was in East Germany, and then when they merged, there were just some kind of set of problems that occurred between he and other researchers. And his institute, I guess, has dissolved following his death, which occurred at a pretty late age, I guess in his 90s. Those are really pretty amazing people. I mean, the power of the intelligence of those people, Otto Warburg and this guy Van Arden, just phenomenal. So I'll just go first to the issue of cancer, because one of his big interests was cancer therapies and cancer management. And again, he was I think a physicist first, and then ultimately a physiologist in medicine. And so his interests gravitated in that direction, and he was among the people who started to develop the hyperthermia concept back in the 1950s. And he thought long and hard about the issue of cancer, because cancer is a disease of anaerobic metabolism and a disease that does better in let's say a slightly acidic environment, and a disease that conceivably wouldn't do as well in a environment that was let's say supportive or for adequate oxygenation. So he's very interested in this, combining with hyperthermia. And he made several observations, which in my mind, everything is speculative because I don't think it's been proven, but I think it's fascinating, and so here goes. Number one, we all form cancer cells, and due to the adequacy of our immunologic processes, we mostly deal with them, and the integrity of the tissue surrounding the cell that's abnormal. So there's the immunologic functions that are systemic, but also the ability to recognize other that is local, and the integrity of the tissue structure that's local, that could inhibit the growth of an abnormal cell and cause it to die. So one of his speculations is that when there are less than 10,000 cells, which are not a lot, that adequate oxygenation would inhibit their growth. And it's a speculation, it isn't proven, but it certainly would be interesting if ever we could see that. So when I see people, which unfortunately occurs very often in our practice, with cancer, I'm really interested in what their oxygenation levels are. Is that N? Remember the difference between the partial pressure of arterial oxygen and venous oxygen, at least greater than 50, or is it lower? And unfortunately, it's often lower. if not at the time of diagnosis, then certainly often by the time of progression to distant sites. So the question is, if oxygenation was adequate and could be induced to be adequate, could we see a greater delay in progression of disease? No one talks about cure, and that's the right thing to do, not to talk about cure and give people false hope. But everyone's working at how do we get people to live a very long time with the cancer they have? Because, and many people could if they weren't, you know, if they took good care of themselves, or we become more sophisticated and don't make a mill of the therapies we give. And we're working, and conventional medicine is really working very hard on that, I think. And this would be such a simple strategy to apply, and relatively inexpensive one, that it would be, you know, on the one hand, it would be simple, on the other hand, it would be elegant. I would obviously need a person who's sophisticated in research design to know how to do it so that it would be meaningful to people, but it is one thing to think about. And so knowing the adequacy of oxygenation may be as important as knowing one's blood sugar, or one's blood pressure, or one's cholesterol, or one's body weight in terms of illness prevention going forward. And that's just a simple statement. It's speculation and isn't, you know, I'm not holding out false hope, but it is a provocative idea that's not one that is, if you would, expensive to determine, nor expensive to correct if an abnormality was found, or a less than optimal situation was found. And in part, when we're going to, the next lecture, I think in December, is going to be on integrative or collaborative oncology, where we try to begin to address a concept of integrating the conventional thinking about cancer diagnosis and therapy with the non-conventional or alternative strategies that might be applied to optimize outcome. But this would be, to my mind, one of those strategies that might be applied in a preventative context, and if not, but I do think it would take a long time to develop a level of proof that would allow me to state that with some absolute sense. But that was one important, let's say, speculation that he made and thought was true, and he even had some evidence to base that on, based upon cell laboratory studies and cell cultures, etc. The next area has to do with realizing that when people get surgery and radiation and or chemotherapy, not inevitably, but almost always, if this is the arterial curve, the arterial pressure, and this is the venous pressure, during the period of that therapy intervention, the arterial goes down and the venous goes up. And typically that's associated with feeling pretty rotten. And so if one of the goals is to administer these therapies in an effective way, again, this intervention has been shown to be beneficial in improving the oxygenation. And frankly, by optimizing oxygenation of tissue, you'll optimize the effect of the intervention. Surgery, wounds will heal faster. Chemo, less destruction to normal tissue, and radiation, less destruction in normal tissue, without, in my mind, injuring or disturbing the background process that they're trying to achieve. In fact, I think it would accentuate it or support it.